Have you ever had the stomach flu? Nausea, vomiting, diarrhea, abdominal cramps, fever. The symptoms are unforgettable. So if you've had it, you'll want to listen to this video. The problem with the word stomach flu, it's a little bit of a misnomer because the word flu is associated with the influenza virus, which is an upper respiratory tract infection. It has nothing to do with the GI tract. What you probably actually had was gastroenteritis. That's a big word to say. You probably had inflammation of the lining of the stomach, the large and small intestines. Most common cause of gastroenteritis are viral infections. Most commonly you have the Rotavirus and the Norovirus. Gastroenteritis can also be caused from other pathogens like bacteria, E. coli, or fungal infections, parasites, protozoal infections, or even just irritations from chemicals or medications or from drugs. So today we're going to talk all about how to manage and treat and take care of somebody that has gastroenteritis, i.e. the rotavirus or the norovirus. And we're going to be making an even better than Pedialyte electrolyte drink, Rehydration fluid. So you want to stick around. My name is Maria Chaudhry. I'm a licensed midwife and an herbalist and the creator of Botanicals. We make nourishing herbal remedies for women and children. And all of our remedies and products are made with high quality organic herbal ingredients. What I'm not though is a doctor. And this is an educational video. Even though I'm going to be talking about treatment plans and talking about viruses, just know that this is a video with the intent to help inform you, educate you, inspire you, so that you know how to make decisions when it comes to the health care of your body or taking care of your child. What you do with the information in this video is ultimately your personal responsibility. This is a continuation of our immune health series. We've spent some time exploring topics like fevers, coughs, colds, flus, RSV, and now today we're going to be talking about the rotavirus and the norovirus. So let's get started. So the stomach flu, the stomach bug, has these symptoms. I just went through them. Nausea, vomiting, diarrhea, fever, pain. These symptoms are all a part of your GI tract, your upper and lower GI tract, your stomach and your intestines, large intestines, small intestines. And viral infections are the most common cause of these infections. And they are common throughout the United States, but they kind of spike up and spring up primarily in the fall and the autumn through the spring. However, and they're stronger and more serious and severe for infants and toddlers. However, anyone can get these viruses at any time of the year, any part of the world. What I want to say about the norovirus and the rotavirus is in this video, I'm clumping them together, but they're two separate viruses and they're two separate experiences, and I really don't want you to think of them as the exact same thing. The reason I'm clumping them together is because they're common and they have similar symptoms, and they're most of the time going to run their course on their own and not need medical intervention or medical attention. And the ways to help you feel better if you have them, or help somebody else feel better if they have it, are similar, but they're very different. So I will separate them out a little bit in this conversation. Okay, I just wanted to clear that up so you're not confused, because they're not the exact same thing. One thing I want to say about the rotavirus in particularly, the rotavirus is one of the most common causes of diarrhea and dehydration in the entire world. And the rotavirus can lead to, like I said, dehydration. And that just sounds like just a word to us here in the United States. We're so fortunate But dehydration in other parts of the world, in developing countries and in third world countries, dehydration is a cause of infant death. Diarrhea is a cause of infant death. And here, we have a few days of irritation and frustration. It is pretty gross. It is hard to deal with. But we have clean water. We have hot water. We have a washing machine. Most of us have a washing machine really close. We have access to medical care and access to a store quickly and easily. And so I don't want to minimize this and just be like, oh, it's just a few days of diarrhea, because a few days of diarrhea in another part of the world can leave really lasting consequences. And I'm going a little off script here, but I read something the other day that was staggering. It was 215,000 babies die from dehydration around the world and from diarrhea around the world. That's really staggering, and it makes you just want to pause and be really grateful for our environment and really grateful for this information and these resources, so you're not in this situation. Okay, so let's break down these viruses. I'm going to refer to my notes because I don't want to miss something. Okay, so we have the Norovirus and the Rotavirus. So the Norovirus is primarily in contaminated food and water. And so the Norovirus is going to come on suddenly, and it's going to have severe nausea and vomiting and diarrhea. The thing about the Norovirus is that it typically starts about pretty soon after you eat. So 12 hours to 48 hours after being infected. And then it can last up to 3 days of having this active nausea, vomiting, and diarrhea. However, the person is still contagious for about 2 weeks, because even though the symptoms pass, there is this thing called viral shedding. And so this virus is shedding, this person is continuing to have bowel movements, and they're continuing to potentially be contagious even though they don't have any symptoms at all. Okay? And so then the rotavirus is really popular and common in situations where there are lots of people in enclosed areas. So like lots of people in enclosed areas, that is a daycare center, a school, a hospital, a dormitory, a cruise ship, a hotel, a nursing home. Those places where people are really in close contact with each other, these viruses are so contagious, it's quickly, and they can spread throughout the community really quickly. So the rotavirus also causes diarrhea and vomiting, and it is, like I said, the leading cause of dehydration in children all over the world. It is, but here's how it starts. It usually starts about 2 days after they're infected, after they're exposed to the virus, and the initial symptoms will last about 3 to 8 days. So what happens is you have about 2 days of fever and vomiting, and then after the fever and vomiting start to settle, then you have about 3 to 8 days of watery diarrhea. So it kind of comes in stages, right? They can also have a lot of abdominal pain and aches and pain and just feel really just terrible. However, in an adult or in a person that has a healthy immune system in general, if they're exposed to the rotavirus, they'll probably have really mild symptoms, or they might not have any symptoms at all. Yeah. So really, it's always the high-risk categories that have the most severe problems. You know, the infants, because they have, you know, they have a developing immune system, or the elderly that have a weakened immune system, or somebody that has like an autoimmune system problem. Okay, so how are these viruses spread? Like I said, the first one, the rotavirus, is spread rampantly in close quarters. But they're both spread essentially via oral fecal contamination. So the story is essentially like this. Somebody uses the restroom, or they change a diaper, they wash their hands, but they don't wash them well enough. They go out and they either prepare food for someone, or they touch an object and then you come around and then you touch that object, and then you touch your mouth or you eat your food, and there it is. That's how it happens. So you can see how quickly it can spread. So let's talk about some ways to prevent it, because you can never underestimate the power of clean hand washing. Hand washing saves lives. I mean, that's the bottom line. So hand washing with soap and water. We used to sing the ABC song with Sequoia. We'd always sing the ABC song just to give yourself enough time to wash your hands. Every time you use the restroom, every time you change your diaper, wash your hands. Also, you want to clean your surfaces, right? Especially if you're cooking for people, clean your surfaces. The problem is the rotavirus can sometimes live even though you're using disinfectant solutions. A lot of times the rotavirus, it doesn't kill the rotavirus, but you still want to clean all your surfaces. You want to have clean drinking water, filtered drinking water, or boiled drinking water. You want to wash your fruits and vegetables in clean drinking water or boiled water, or use a vegetable rinse on your produce. You want to thoroughly cook your food. Ideally, you want to avoid food cooked by someone who has been sick. This is just an optional thing, but this is my thing that I'm adding to the list, is avoiding, buffets. Because when you think about a buffet, how many people just walked in, went to the restroom, washed their hands a little bit, and then they're talking on their phone, they're touching all the utensils, the food has been out for hours, and you have lots of people coming through to the buffet. We all choose buffet when we have big family gatherings. Everyone gets to pick what they want. I fully understand it. At the same time, be aware of that. And the other thing is, when you're taking care of a sick person that has diarrhea and vomiting, you want to love them up. At the same time, you want to isolate that person. They should be quarantined, right? And not really around a lot of people. And in this next section, I really want to talk about ways to help manage gastroenteritis, and really what I should be more specific and say viral gastroenteritis, because I said earlier this inflammation can be caused by a lot of things. But if we're talking about viral gastroenteritis, then antibiotics aren't going to help. But if you had E. coli gastroenteritis, then maybe antibiotics would help. But viral, antibiotics aren't going to help you. Antivirals aren't going to be very effective. And anti-diarrheal medications also aren't going to be very effective. So you're really left with home remedies, self-care remedies to help a person feel better. And also you have to go with the body. The body is very wise, and you have to allow this whole process to run its course. Like when your body is trying to evacuate something, it's for a reason, and you don't want to stop it, right? You want to allow it to be fully cleansed. So these are the measures. If you are breastfeeding, obviously continue to keep breastfeeding. Offer the breast as much as possible. If the infant seeming like you need an extra level of care in your breastfeeding mom, you can give them little bits of oral rehydration drink that I have and I'm about to cover. Now, if you're bottle feeding, you can intermittently give the bottle and the oral rehydration drink, but don't dilute the formula to try to get them more water, right? Also, you might consider, if you're having a dairy product in your formula, maybe consider to change that right now, because the dairy can exacerbate the symptoms. Okay, after the person has gone through a lot of their vomiting, you could give them herbs like stomach soother, because stomach soother is blended with ginger, peppermint, and fennel. And it will help them after they've gone through their vomiting and diarrhea, and then they're starting to recover, but they still have those cramps, they still have nausea, they still have, they're really depleted and they need to absorb nutrients. And so stomach soother will be really helpful for that. If you're giving stomach soother to an infant, you're going to give them 1 drop per 5 pounds of body weight. You can put it in their bottle, you can drop it in their mouth. The thing is, when you drop it in their mouth, they're going to make a face, right? They're going to because it's startling, it's new to them. That doesn't mean they don't like it. It just is new, and so they're going to make a face. So know that. If you know your hands are really well, I just said oral fecal contamination, so you have to be really good, clean, soapy, clean hand, but you could drop a little bit on your finger and they could suck it off, or you could drop it on your nipple and they could nurse. And that's a way that they could get the stomach soother. Okay, so for older children that can swallow a capsule, you can give them activated charcoal. If they can't swallow the capsule, you can also open up the capsule and put it in a spoon and add a little bit of water, and you're going to make this like black paste, and they can drink it, right? Just know that their mouth is going to be all black, right? So then they're going to need to have little sips of water. You don't want to flood their system, but they need a little sips of water. And so once you open up the activated charcoal, it's really messy. The benefit of the activated charcoal is it absorbs the toxins, it absorbs the viral shedding, it absorbs all the things that are irritating your stomach lining. And so it's a great way to help expedite this process. The other thing is if they can start to eat, if you can start to eat, and this child can eat, or you can eat simple foods like crackers or toast. And if you're going to make toast, you don't want to put the butter on it, but you want to burn your toast. And you have black burnt toast, very, very wonderful burnt toast. But the burnt toast is just like activated charcoal. It's going to absorb the pathogens, and so that's another option for you. If they can eat and they can start to hold down fluids, of course, bone broth, vegetable broth, chicken broth, those are great ways to help them get the nourishment they need. And the same, I'm about to go into ways that they can stay really hydrated with teas and waters and rehydration electrolyte drinks. The thing is, you want to avoid sugary things like soda or really sugary apple juice or even dairy products, because all of those things just irritate and promote diarrhea, and it's going to make everything worse. So you want to avoid that. And for a child, this doesn't really apply, but for an adult, things like caffeine, alcohol, tobacco, hot spicy foods, greasy foods, really flavorful foods, all of that just perpetuate your problem. Another thing is once it's kind of cleared up and you can hold things down, then you can start to reintroduce beneficial bacteria, and you can have your probiotics and your probiotic rich foods and your prebiotic rich foods. A couple other things to think about when you're taking care of someone that has gastroenteritis is to really, what you want to do is when they're sleeping, and I'm just thinking about just some practical tips to help things be clean, because here's the deal. One thing you have to do is you have to take care of somebody that's vomiting, and that takes a lot of effort. But then you also have this whole other thing called a lot of laundry, and you have to make all these rehydration drinks, and you have to make all this stuff to take care of them, and so you kind of need a tag team. So one easy thing is whoever is sick, when they're laying down, put them on like 2 towels. So they're laying down on one towel, they have another incident, you can quickly clean it up with that one towel, put that in the washing machine, and they're still resting and laying on a clean surface, and you don't have to change the whole bed every time there's an incident. That's one idea. And the other one is just like reinforcing what I just said, really tag team, because someone needs to be on laundry duty, someone needs to be on cleaning duty, someone needs to be on making drink duty while the other person is tending to the person. And if this is about to go through your household, you're going to have to really get good at your systems, because you're all going to take turns getting sick. Okay. Oh, and another thing, you know this, especially if you're a parent and you're dealing with a child, they can be really startled by what's happening, and they can be really afraid by what's happening. And this is an opportunity to remind them that their body is really powerful and really strong, and that what's happening is healthy, even though it's scary, and that they'll recover, because it's really frightening when you vomit for the first time, especially when it's so violent. Okay, so Let's prevent dehydration. Remember, dehydration is the biggest concern. So how we're going to do that? Water is a great way to help prevent dehydration, little sips of water. However, there's a lot more. You're not just losing fluid, you're losing carbohydrates, you're losing proteins, you're losing minerals. And so we want to get all those things back into your system. So, you know, you always want to listen to your child, and when they're like at first getting sick, at their first sign of getting sick, they might lose their appetite, and you're like, come on, eat, eat, eat. But it's really okay that they don't eat that much, obviously, because they're about to vomit and they won't be able to eat. But there is something to be said about not eating. However, once your child starts to lose their appetite, that is your cue to hydrate them and to get really creative with these oral rehydration options I'm about to give you. Okay, here we go. The first one is an electrolyte drink. And the electrolyte drink, I have the recipe on our blog, so the blog is up right now. You can go look at the blog. I'm going to tell it to you, but I'm not going to sit here and make it for you right now. It's super simple. I'm all about simplicity, the easiest thing to do. You get a pint jar, that's a small jar. It's about 2 cups of water, a half of a lemon, 2 teaspoons of maple syrup, a pinch or a 1/4 teaspoon of either Himalaya mountain salt or sea salt. Here's the thing, 5 or 10 drops of chlorophyll, and or about 5 or 10 drops of stomach soother. Put all that in a jar, put your lid on it, shake it up really good. Voila. Rehydration, better than Pedialyte, better than Gatorade. There are no high fructose corn syrup, red dye 40s, artificial colors, flavors, and it is enhanced with herbs and enhanced with really beneficial oxygenating properties and mineral rich properties of the chlorophyll. A pint seems like a small amount, but for a small child, a sick child, they're probably not going to drink that much in a day. You're going to have to give them little teaspoons every like 15, 20 minutes. Here, have a teaspoon, or have a tiny sip with a cute little straw, right? They're not going to just sit there and drink the whole thing. If they don't drink the whole thing and it's clean and it's not contaminated, you can put it in the refrigerator for a couple of days. If you're taking care of more than one person and you're drinking it yourself, just go ahead and double the recipe and put it in a quart-sized jar. Okay, step 2 for your better than Pedialyte rehydration formula. You can just do that, or you can take that and simply pour it into popsicles and ice trays and turn that into a popsicle. Or you can enhance it and make it even better. So let's make it even better. We're making these herbally infused, medicinal, easy to absorb, rehydrating popsicles. You can do this a couple of ways. Once again, the simplest is the best. You can have 2 cups of tea. Ideally, the tea has elderberry. So elderberry tea, like elderberry tea from immune tea. So you have elderberry tea, and then you could add a little bit of your favorite juice. A fruit juice goes good, like a blueberry, a pomegranate, a grape juice can go in there, right? A nice dark color. You can add you need your pinch of salt. Optional, now that you have juice in there, it might already be sweet enough. So an optional maple syrup, and then your chlorophyll and your lemon. And that becomes the benefit of adding the elderberry and the chlorophyll and all the juice, really is what I'm trying to say, is the elderberry and the juice are high in antioxidants and high in vitamin C, and elderberry is an antiviral, so it has this other medicinal layer component to it. If you choose to make it with the immune tea that we just showed you, The immune tea is also blended with chamomile, elderberry, peppermint, and echinacea, and those herbs are well known to support gut health and to help support recovery and help support fevers. And so it's just going to be a way to enhance and improve your popsicle. All right, another thing about popsicles I do want to say is they're not going to eat the whole big popsicle, so put it in ice trays so they can have little tiny bites. What else? Okay, the next thing is the natural Jello made from beef gelatin. Jello has been one of those things that back in the day was really healthy, and now it's been adulterated with a bunch of sugar and artificial colors, and so we don't think of it as a health food, but let's look at it from the lens of a health food. Because Jello is a great source of protein and amino acids, it's easily digestible, it's considered a liquid diet food, it is usually a part of gut health protocols. One of the benefits of gelatin is that it coats the smooth and the small intestines and soothes the irritation and inflammation of the intestinal lining, and it's really nourishing. Plus, gelatin is one of those foods that's free of a lot of allergens. There's no egg, no dairy, no gluten, no nuts, and you can make it sugar-free, so it is a really good option for you. And the recipe is on the website, and I'm really just going to briefly explain how to do it because you kind of need a couple of steps here. But you need your 2 cups of your tea and your juice. You separate your 2 cups. One of the cups you put your sugar in and your maple syrup in, and you heat that up. The other cup you set aside and you put your gelatin crystals in. Once you start to heat up your tea and your sugar and it just gets to boiling, don't let it boil, but as soon as it gets to about boiling, pour your hot water over your gelatin, add your chlorophyll, stir it up, and then you let it sit in the refrigerator for about 4 hours, and then you'll have your mineral-rich, protein-rich, rehydrating, healthy Jello. You could put the Jello in one bowl, or you can separate it out into little containers. I've talked to you a little bit already about the benefits of all the herbs in there, but if you want to know more about each one of those herbs, there'll be links in the description below, and you can check out those herbs. And we have so many supporting videos that talk about the benefits of these herbs, so I think we'll have that covered. And the other thing I wanted to talk about briefly is, I always talk about this, when you're taking care of somebody at home, and you're having to decide how healthy and how sick is this child, how severe are these symptoms, how long have they had these symptoms, what's making this worse, what's making it better, what resources do I have at home, do I need help, do I need to go to the hospital? So in order to analyze and assess those situations and to remember it all, I encourage you always to write it down. Always write it down, and I'm considering making you guys a template to help you write it down, to help you ask the questions and answer the questions so you can have accurate time frames. And so if you'd like that template, let me know and I'll make you one. I just want to get some feedback to see if that's actually something you'd like. So here you are, you've taken care of your sick child, and you're trying to figure out, when is it appropriate to keep him home, when is it time to go to the doctor. It's pretty clear. If you want to go, most of the time things are going to resolve by themselves, but it's time to go to the doctor if your infant or your child has had diarrhea or vomiting for more than 24 hours. If they have dark black stool, if there's blood in their stool or blood in their vomit, if they have a temperature of 104 degrees, if they seem really lethargic, listless, if they have signs of dehydration. Signs of dehydration are little to no urination, crying without tears, a sunken fontanelle, a skin turgor that doesn't recoil. They're super sleepy and they're unresponsive. Those are clear signs to take your baby to the doctor to get evaluated. If you're an adult, the signs are really simple and really similar. If you can't hold fluid down for more than 24 hours, you should go to the doctor. If you've had diarrhea for more than 2 days and it's not resolving, if you have blood in your bowel movements, if you have a temperature of 103 degrees or higher, or if you have signs of dehydration, which will be excessive thirst, a dry mouth, little to no urination, and when you stand up, you're really lightheaded, you feel dizzy and really weak. Those are perfect times to go to the doctor. Okay, so I want to kind of wrap this up. I hope you found this video helpful and informative and not that gross, even though it's a kind of a gross topic. I do want you to be left with a few gentle reminders. Just remember that your body is wise. It knows what to do and it can recover. Remember that babies are resilient. Herbs are safe when you use them appropriately. Your doctor is a phone call away if you need them. And that we're here to support you. We can support you by offering you these products, and to support you with our videos, you can go to Birthsong Botanicals on YouTube, and there's a whole list of immune videos. You can go to Birthsong Botanicals on SoundCloud, and there's a whole podcast. You can go to Birthsong Botanicals, and on our blog, we have an extensive blog that is filled with information to help you and your family stay healthy, happy, and wise. And if you like this video, pretty please push like, share, subscribe, leave us a comment. And until next time, my friends, drink deep and always walk in beauty.